Hello everyone, welcome back to my channel. So in this video we will be discussing about H1 antagonist or conventional antihistaminics, right? So we are giving the name antihistaminic to only H1 antagonist. Okay, when we will be asked about antihistaminic, we will only talk about H1 antagonist. Okay, so competitively they antagonize competitively the action of histamine at H1 receptors. So now we will call them H1 blocker 2. So they are of two type. One is first generation drugs and second is second generation drugs. So they are classified into these two classes on the basis of like the second generation drugs. They are now employed after nearly 1980, and they are less sedating and even non-sedating drugs. That's why they are known as second generation drugs. And the first generation drugs, they are very they were sedative. They had a action that causes sedation. So qualitatively, all the H1 antihistaminic had the similar action, but there are quantitative differences, especially in the sedative pattern, and that's why they have been classified into three types. One is the highly sedative drugs, second is moderately sedative, and third is mild sedative. So in highly sedative, we can you can remember the drug by PhD. For P we have promethazine, H is hydrazine, D have 2 diphenyldramine or dimethylhydrinate. Okay, so on moderately sedative you have PCM, P for phenyramine, C is there are 2 synergine and uh, cyproheptadine, and M is miclozine. And mild sedative, which are mild sedative, they are you can remember by DCT, like distal convoluted tubule, you can remember that. So they are dexchlorofenyramine या फिर chlorpheniramine, okay, C से clemastine and tripolodine. Okay, and second generation drugs like cetirizine, levocetirizine, fixofenadine, loratadine, desloratadine, azilastine, mesolastine, and rupatadine. So in this video, we will be discussing about first generation drug. Second generation drugs will be discussed in the next video. So we had discussed that qualitatively all the H1 antihistaminics have similar actions, but they are quantitatively different, which are present in the sedative property. We have discussed that. So pharmacological actions now. So H1 blocker, they causes CNS depression, sedation, which was a feature of first generation drugs, drowsiness, and certain antihistaminics have antiemetic action, local anesthetics, we will be discussing about that, and anti-Parkinsonism effect. So they have anti-allergic reactions as well, because we have discussed that histamine is a causes allergic reactions. So on CNS, the older antihistaminic, they produces used to produce variable degree of CNS depression, because of we have discussed that about the non-masked histamines which are present in the brain and hippocampus. Okay, so and this variable degree of depression is depend upon the ability to penetrate the blood brain barrier. So some individual also experience stimulant effect like restlessness or insomnia, right? So like promethazine, we had discussed, it is highly sedative. It also controls the vomiting in pregnancy and other causes. And promethazine and few other antihistaminic, they reduces tremor, rigidity, and Parkinsonism. Some older antihistaminic first generation, especially cyproheptadine, have appetite stimulating effect. Okay, and they have anticholinergic effect, which causes dryness of mouth, blurring of vision, constipation. These are adverse reactions basically. Local anesthetist. So there are some drugs which have a very good tendency for penetrating the membrane. Okay, they can have a very strong, but they are very weak membrane stabilizing property. See, they cannot use clinically as a local anesthetics, because they will cause irritation when they are injected. Okay, these drugs are like phenyramine, promethazine, diphenylhydramine. Okay, on BP, most of the antihistaminic, they cause a fall in BP. On IV injection, we had discussed about it, because of direct smooth muscle relaxation or alpha adrenergic blockage. Promethazine has a significant alpha blocking activity as well. Now, the pharmacokinetic. So, H1 histaminics are well absorbed after oral and parenteral administration, and they are distributed widely throughout the body. They are metabolized in liver and they are excreted in urine. So, now the adverse effect. The common adverse effect are sedation, we have discussed, drowsiness, lack of concentration, headache, fatigue, weakness in coordination. So H1 antihistaminic should be avoided while driving. So these H1 antihistaminic we were talking about that should be contraindicated in driving. These are first generation. Second generation drugs can be used by drivers while driving, okay, because they don't have a sedative property, or they have a very less sedative property, and these side effects are rare with second generation antihistaminic, we know. Gastrointestinal effects like nausea, vomiting, loss of appetite, gastric discomfort. So all these are this. Anticholinergic side effect, that dryness of mouth we had discussed, blurring of vision, constipation, and urinary retentions. These are not because occur in second generation drugs. Allergic reaction may occur rarely with these agents, especially contact dermatitis on topical application. So that's all for this video. Thank you for watching, and please subscribe to my YouTube channel.